Hi everyone, Dr. Omi from Pain Free and Fit. Today we're going to talk about how to train shoulders heavy using one-arm techniques for those of you with lower back herniated, bulging, and degenerative discs. Hope you enjoy. So if you've seen any of our previous videos on the channel about heavy training and disc problems, whether it be disc herniation, degeneration, or bulging, you know that one of the prime things we try to stay away from with training is flexion or bending forward from the waist, because that compresses the anterior front portion of the disc, many times causing fluid to be pushed from the center of the disc into those tears and aggravating degeneration, herniation, and bulges. We also try to stay away from seated exercises, because seated exercises, especially with overhead type motions, put a lot more pressure on the disc. If I have a 200 pounds of pressure standing on my disc, it's going to turn into 23 to 2600 pounds possibly when I'm sitting. And that's going to be a lot worse if I'm then pressing overhead. So that's why many times seated shoulder work aggravates disc problems. So one of the things we can do is take ourselves out of the seated position and use either barbell or dumbbell work standing to decrease disc pressure. But for a lot of people with really acute herniations and discs, and they're saying, you know, my back's been really killing me, it's been bad for a while, even standing shoulder presses is too much of a stress, using a one-arm technique with dumbbells goes a long way. When we're standing and shoulder pressing with one arm, there is a natural tendency when the weight gets heavy to use more of a lateral sway to push up, rather than when we have two hands on a bar, we have more of an extension sway to push up, because as the shoulders get weak and we're shoulder pressing either with behind the necks or front military presses, the pecs after a while are going to try to join in to help the shoulders, and the pecs are recruited when we lean back, because that changes the arc of the motion from straight up and down to a slight forward motion, recruiting more of the upper pec. So especially later in the set when you're more fatigued and you're trying to eke out those last couple reps, many times as opposed to staying straight up and down, you're going to start extending. And if you have a posterior herniation and you extend, that many times is going to aggravate disc conditions, even degeneration with extension. Both flexion and extension aggravate, meaning bending forward and bending backward on disc pain. So by using a dumbbell and doing our shoulder press, we're a lot less likely to extend to get that last rep up, but we're more likely to laterally or sideways lean to complete that rep. Typically, with most people with disc problems, sideways motions are not going to be as aggravating as flexion and extension motions. Also, lateral raises or upright rows. If we take a bar and we're doing an upright row with two hands or two dumbbells, or we're doing a lateral raise with our arms out to the side, you're going to notice that to get the weight up, many times, again, when we get to the latter portion of the set, we're going to put some extension into the body. If we're doing cleans, let's say, same thing, we're going to put extension in to bring the weight up, whether we're doing a hang clean or a classic clean from the floor. So by taking a dumbbell and changing a two-handed exercise, which promotes extension of the spine in any of those three exercises as we get the last reps, doing a one-armed exercise, again, changes or transfers that cheating or that momentum ability from extension to more of a lateral motion. So you can use actually many times more weight in your hand on one arm, both in a lateral raise, an upright row, a clean, where you're going to be bombing the shoulder more and creating a more intense workout with the shoulder than you are with two dumbbells or a bar where you're going to have extension. You're going to find you're going to aggravate your back with less weight. You're going to be able to use more weight on that one side because you have stability muscles in your shoulder also working, creating a more intense workout for your shoulders without aggravating your lower back disc herniation, bulge, or degeneration. If you like this video on training shoulders with disc problems, feel free to subscribe to our channel. We got a lot of great videos out there to help you along. Questions or comments, write in. I'll do my best to answer you. And remember, if you're looking for a great program to figure out how to train, how to develop a self-rehab program that includes spinal stability, how to choose exercises, how to design a workout routine that doesn't aggravate your disc condition, check out our Fast Track Degenerative Disc program at painfreeandfit.com. I hope this video on shoulder training by using one-arm positions and modifications helps you with your lower back degenerative, herniated, and bulging discs.